Morning. We'll talk about cold agglutinin test today. So let's start with our discussion. Okay, so first is what is autoimmune hemolytic disease or hemolytic anemia? So individuals with this disease form antibodies to their own red blood cells. So the cause of the destruction of red blood cells is the presence of autoantibodies, autoantibodies that attack the red blood cells. Okay, and that causes decrease in the number or count of normal red blood cells. So that's for autoimmune hemolytic anemia. So one of the causes of autoimmune hemolytic anemia is the cold agglutinin. So regarding a cold agglutinin, first, what is agglutinin? So agglutinin, it is an antibody that can agglutinate antigens. Okay, so antibody that can agglutinate antigens. So agglutinin. Okay. Next is the term autoantibodies. So autoantibodies, antibodies against our own cells. And if we talk about cold agglutinin is an autoantibody that agglutinate with antigens of RBC when exposed to temperature between 4 to 25 degrees Celsius. Okay, so meaning of cold agglutinin, it is an autoantibody that is capable of reacting with the antigen present on the RBC, okay, once exposed to cold temperature. Okay, so from 4 degrees Celsius to 25. So that's the characteristic of cold agglutinin. Okay, so at normal body temperature, like 37 degrees Celsius, for cold agglutinin, it has no effect. Okay, usually has no effect. Okay, so no reaction between the autoantibody and the antigen present on the present on the surface of the RBC. Okay, so that's for cold agglutinin. And regarding cold agglutinin, it is 30% of all immune hemolytic anemia. So of all the cases of immune hemolytic anemia, cold agglutinin is 30%, okay, of all the cases of immune hemolytic anemia. And it usually develop during 50s or 60s, or it usually develop in old individuals. Okay, so that's for cold agglutinin. Next, the trigger, okay, for the production of cold agglutinin. So first cause, okay, of the production of cold agglutinin, you have Mycoplasma pneumoniae infection or your primary atypical pneumonia. Okay, so usually 50% of patients with cold agglutinin, they develop due to Mycoplasma pneumoniae or primary atypical pneumonia. So antibodies are produced at 7 to 10 days, peak at 2 to 3 weeks, and persist until 2 to 3 months. And another cause, okay, of uh, what do you call this? Another cause of cold agglutinin production, you have infectious mononucleosis. And regarding infectious mononucleosis, the cause of infectious mononucleosis is your Epstein-Barr virus or the causative agent of kissing disease. Okay, because the uh, primary mode of transmission of EBV is through or via saliva. Okay. So only a small percentage of patients have titers that can induce in vivo hemolysis. So for infectious mononucleosis, there's only a small percentage of patients with infectious mononucleosis and cold agglutinin that will induce in vivo hemolysis, okay, or inside the blood vessel hemolysis. Another cause of cold agglutinin production, you have CMV, mumps. Other causes, you have chronic lymphocytic leukemia, non-Hodgkin's lymphoma, and SLE. So cold agglutinin is also not always, but there are certain cases of SLE that can trigger the production of cold agglutinin. Next, reactions are seen in the patient if that individual is exposed to the cold and cold and the temperature in the peripheral circulation falls below 30 degrees Celsius. So regarding this autoantibody is significant if the temperature is cold. It's from 4 degrees to 25, or 4 to room temp, 4 degrees Celsius to room temp. At 37 degrees Celsius, there's no reaction. Okay? That's for your typical cold agglutinin. So meaning, cold agglutinin, or um, the presence of cold agglutinin is not that severe. It's not that serious disease, because our typical response is if we're exposed to cold temperature, then move ta sa warm nga temp, because ideal man sa atong body ang warm nga temp, not ang super cold. Okay? So that's why it's easy to avoid uh, cold agglutinin, or the effects of cold agglutinin. Okay? So um, in the presence of cold agglutinin, and if that cold agglutinin is capable to react with the antigen present on the surface of RBC, so after the reaction between the cold agglutinin, which is the antibody or autoantibody, and the antigen present on the surface of the RBC, after that reaction, next is you have the activation of the complement system. Okay, and remember, if we talk about complement, the goal of complement is to cause lysis. Okay, so after complement activation, you have intravascular hemolysis, and the effect of intravascular hemolysis, meaning there is destruction of RBC, is decrease in red blood cell count. Okay, that's why it's autoimmune hemolytic anemia. Anemia meaning low RBC count. Okay, now regarding cold agglutinin disease, it is reversible upon exposure to warm temperature. Okay, because cold agglutinin, the typical cold agglutinin autoantibody, it's an IgM. So it usually react at cold temperature. So at warm temp, it has no reaction. Okay, so you can easily reverse cold agglutinin disease. Okay. Next, reactive only at low temperature and no clinical problems at usual body temperature. Okay. Work best at 25 degrees Celsius, 18, 14, but retain some activity at 37, especially if you have paroxysmal cold hemoglobinuria. Okay. Because in paroxysmal cold hemoglobinuria, this is not your typical cold agglutinin disease, no? So for paroxysmal cold hemoglobinuria, you're producing IgG antibody, IgG on the autoantibody that is capable of reacting at 37. But for the typical cold agglutinin, you're producing IgM. Okay, so for IgM, it's easy to prevent or to reverse the effects of cold agglutinin because it's IgM. Okay, but there are certain cold agglutinins that will react at 37, especially if the autoantibody is IgG. Example in your paroxysmal cold hemoglobinuria, or PCH. Okay, so regarding cold agglutinin, it's usually transient and resolves within 2 to 3 weeks. Okay. Next, there are two types of cold agglutinin. So the normal or the benign, you have your IgM. And for IgM, uh, it's usually anti-I, meaning this is an antibody against your I blood group system. Okay. And it usually react at cold temperature, no reactions at 37. So agglutination is reversed upon exposure upon return to 37 degrees Celsius, meaning there is no agglutination, no RBC destruction at 37. But at cold temperature, you have destruction of red blood cells. Okay. Second type of cold agglutinin, you have your IgG. So it's a biphasic autoantibody. So meaning of biphasic, it can react at cold temperature and also at 37 degrees Celsius. So agglutinate at cold, and it also activate the complement system at 37 degrees Celsius. Okay, so example in paroxysmal cold hemoglobinuria. And the antibody or autoantibody, it's anti-P. So it's an autoantibody or antibody against your P blood group system. Okay, so that's for IgG. So between IgM and IgG, this one is the more serious condition. This one, it's for IgM anti-I, it's easy to reverse, okay, and IgM, because once you expose yourself to um, warm temperature, then the IgM cannot react now with the antigen present on the surface of the RBC. Okay. Okay. Next is benign cold agglutinins may interfere in serological hemagglutination tests like ABO typing, cross-matching, HG test, so anti-human globulin test. So there's a possibility that you'll have false reaction in your ABO typing, cross-matching, and HG test because of cold agglutinins. Okay, so the corrective measure is to heat sample at 37 degrees Celsius prior to testing. Okay, so that's the uh, corrective measure. Okay, to eliminate the ability, okay, of the IgM to react at 37 degrees Celsius. Okay. Now, regarding benign cold agglutinins, it's only a problem once you perform open heart surgery. Because in open heart surgery, I'm not that sure, no, but in open heart surgery, you'll use a machine to work as or to replace the activity of your heart. Okay. Siya ang mo pump og blood, and once mo sulod ang blood sa machine, ma-expose siya sa cold temperature. So that can cause reaction, okay, of the cold agglutinin with the antigen, okay. So that's the major concern lang regarding cold agglutinin, the performance of open heart surgery, okay. The next is you have benign and pathologic. Okay, so for benign and pathologic um, form, no, benign and pathologic cold agglutinin. So it's usually for benign, it's 20 to 24 or 4 to 25 degrees Celsius. You have your typical cold agglutinin, which is your IgM. And if the titer is less than 64, that is classified as benign. It is only pathologic once it's greater than or equal to 64. And if the uh, if the cold agglutinin is capable of reacting at at temperatures greater than or equal to 30 degrees Celsius. Example, you have the IgG antibody, IgG auto antibody. You have the biphasic antibody um, that is seen in paroxysmal cold hemoglobinuria. Okay. And another is for pathologic, it is strongly enhanced with albumin. So once you add albumin in the reaction, the agglutination is enhanced. Okay. And for pathologic, it's usually a correction. This is anti-P. Okay. The biphasic antibody. Okay. So that's for benign and pathologic. Okay. So normal, it's less than 64. And remember, for cold agglutinin, it's only serious, or it's only a disease that murabag if consider nimo siya nga serious disease once it is capable of reacting at 37. Okay? Kay, 'di ba, the typical ginabuhat sa body is if if cold, ganahan yung ka moadto sa warm nga area or sa warm nga temperature. So you can easily reverse cold agglutinin reaction. Okay? Except for paroxysmal cold hemoglobinuria. Okay? Next, so cold agglutinin disease. So cold antibody-induced hemolysis may be chronic or episodic. Hemoglobin levels rarely fall below 8 to 9 grams per DL and often remain within normal range. It may be necessary for the patient to wear gloves, avoid cold exposure, or move to a warmer climate in order to reverse the disease. Okay? And it is not a life threatening disease, okay, because you can easily reverse the effect of cold agglutinin disease. Next, disorder due to monoclonal autoantibody directed against RBC antigens and are reactive at cold temperatures. Okay, so disorders due to monoclonal autoantibody directed against RBC antigens, and reactive at cold temperature. So in cold agglutinin disease, you're producing autoantibody, and the characteristic of that autoantibody, it is capable of reacting with RBC antigens at cold temperature. Okay. Next, hemolysis is mild and self-limiting. Okay. And in cold agglutinin disease, you have the appearance of acrocyanosis, or also called Raynaud's phenomenon. Okay, so in Raynaud's phenomenon, so it's very rarely powerful cold reacting antibodies cause agglutination in the cooler superficial parts of the vascular bed, such as the finger, toes, or with open heart surgery. This phenomenon may produce clinical syndrome of acral cyanosis and may be associated with ischemia to the hands and vasospasm. So in acrocyanosis, you usually develop in the hands, feet, ears, and nose with numbness in the extremities. Areas develop a blue discoloration and become numb, stiff, and slightly painful. Okay, so in acrocyanosis, meaning kana ganing na blue discoloration sa fingers. Okay, so nag-blue siya, meaning no enough circulation or blood circulation. And the reason why nga nung na less blood circulation, it's because of the reaction of your cold agglutinin. Okay? So symptoms are reversible when patient is exposed to warm surroundings. Okay? And peripheral necrosis may result in severe cases. Okay? So in acrocyanosis or Raynaud's phenomenon, you have blue discoloration sa imong fingers, pwede sa ears. It's because of the reaction of your cold agglutinin, and you can easily reverse that one by transferring from cold temperature to warm temperature. Okay? So the reason nga na acral cyanosis or acrocyanosis or Raynaud's phenomenon, it's because of the cold agglutinin. Okay? Next, other symptoms of CAD, you have weakness, pallor, weight loss, hepatosplenomegaly, and jaundice. So there's jaundice because of the destruction of your red blood cells due to the presence of autoantibodies. Okay. Next, paroxysmal cold hemoglobinuria. And it is a least common type of autoimmune hemolytic anemia. It's only 1 to 2% of the cases of hemolytic anemia, autoimmune hemolytic anemia, and it's usually preceded by viral infection. Okay, so you have anti-P antibody, and it is a biphasic antibody. It's capable of reacting at warm and cold temperature. And to confirm paroxysmal cold hemoglobinuria, you need to perform Donat-Landsteiner test. I think Donat-Landsteiner test is discussed in your blood bank subject. Hemolysis may be severe, producing hemoglobinemia and hemoglobinuria following exposure on return into the warm temperature. Okay? So, bisan pag mo transfer ka sa warm, there's a possibility of hemolysis due to the presence of biphasic antibody. Condition occurs most often as a transient disorder in children and young adults. And same with your cold agglutinin disease caused by IgM. Paroxysmal cold hemoglobinuria is also a transient disorder. Okay, but it is more serious than your cold agglutinin disease or your typical cold agglutinin disease caused by IgM, because this one you're producing IgG, which is capable of reacting at cold and at warm temperature. Next, signs and symptoms. You have acute, rapidly progressing anemia. Hemoglobin is seen in urine, okay, due to increased destruction of red blood cells. Laboratory findings, you have hemoglobin as low as 4 to 5. Poikilocytosis, okay. Then you have polychromasia and nucleated RBCs. So increased nucleated RBCs because you have increased destruction of red blood cells, so your body will produce um, more of RBC, and usually it's nucleated because it's immature. Okay. Next, so for cold agglutinin test, so principal cold agglutination of red blood cells occur at 0 to 5 degrees Celsius temperature and does not occur at 37 upon warming. Cold agglutinins can be adsorbed onto red blood cell surface upon exposure to cold temperature, thus it is removed from the serum. It is released back upon warming at 37. This characteristic occurs with all kinds of red blood cells regardless of the group or ABO type. Okay, so for the procedure, sample cold agglutinin test procedure, prepare a test tubes in a rack and label with numbers accordingly. Place 0.8 ml NSS to tube number 1 and 0.5 ml NSS to tube 2 to 7 and add 0.8 ml patient serum to uh, test tube number 1. Okay, so 0.8 NSS to 1, 0.5 to 2 to 7. Okay, then zero point 0.2 serum. Prepare serial two-fold dilutions by transferring 0.5 ml from tube 1 to tube 2 and so on. Discard. Add to each tube 0.5 ml wash RBC suspension. Cover. Shake the tube thoroughly and refrigerate overnight. Immediately after removal from the ice bath, hold each tube over a well-illuminated. Shake each tube gently but quickly to dislodge RBC. Okay, so regarding the procedure, regarding the procedure for cold agglutinin, so you need 7 test tubes. Okay, 7 test tubes. Okay, so first is to place 0.8 ml of NSS in first tube, then 0.5 second, third, zero point 0.5, point, this is zero point 0.5, then this is also 0.5, zero point 0.5, and zero point 0.5. Okay, so zero point 0.8 NSS, 0.5, 0.5, 0.5, 0.5, 0.5, 0.5. Okay, next is to add 0.2 ml of patient serum. Okay, so in the first test tube, the dilution, diba, dilution is sample volume over total volume. So the sample volume is 0.2, then the total volume is 1. So the dilution is 1:5 for the first dilution. Okay. The next is mix this one, then transfer 0.5 ml from test tube 1 to test tube 2. So the sample volume for test tube 2 is 0.5. Okay, that's the volume you get from test tube number 1 that contains serum. So 0.5 is the sample volume. Then total volume is 1. So this is 1:2. So 1:2 times 1:5, the answer is 1:10. Okay, so the test tube number 2 is 1:10. Next is to transfer 0.5 from test tube 1, test tube 2 to test tube 3. So same with test tube 1, test tube 2, the sample volume is 0.5 because that's the amount of fluid you get from test tube 1, test tube 2 to test tube 3. So 0.5, then total volume of your test tube 2 is, test tube 3 is 1. So this is 1:2. So 1:2, multiply it with the previous dilution, which is 1:10. So the dilution, final dilution of your test tube 2 is 1:20. Okay. Then transfer zero point 0.5 from test tube 1, test tube 3 to test tube 4. So same, the sample volume is 0.5, then over 1 total volume, so 1:2. So 1:2 times 1:20, this is 1:40. Okay. Transfer zero point 0.5 from test tube 4 to test tube 5. So sample volume is 0.5 over 1. This is 1/2. So 1:2, 1 over 2 times 1:40. That's 1:80. So there's twofold serial dilution of 5, 10, 20, 40, 80. Then 6, transfer zero point 0.5 from 5 to 6. So zero point 0.5 total sample volume divided by 1. So it's 1:2. 1:2 times 1:80. That's 1:160. Okay. The next is zero point 0.5 from test tube 6 and discard. Okay, discard. So this one is your negative control. Number 7 is negative control. No serum. Does not contain serum. Then next is, after that one, you need to add RBC suspension. 3% RBC suspension. Okay, from the same. So serum, you'll use serum and RBC suspension from the same patient. Okay, so you need to prepare serum and RBC suspension. Okay, so you need to collect serum and your whole blood for cold agglutinin test. From the same patient, dili pwedeng a different ang source of serum and RBC for cold agglutinin test. So you have your 3% RBC suspension, add zero point 0.5 to first test tube. So, diba, the remaining volume of this one is zero point 0.5 because you transfer zero point 0.5 from test tube 1 to test tube 2. Okay? So, zero point 0.5 RBC suspension is one of the, or it's your diluent. Okay? Because your sample is the remaining fluid in this test tube. Okay? So, the remaining fluid is zero point 0.5. Plus zero point 0.5 RBC suspension, the total volume is 1. So, this one, the dilution is 1 is to 2. But you have your previous dilution, which is 1 is to 5. So 1 is to 2 times 1 is to 5. The final dilution of test tube 1 is 1 is to 10. Okay. Next is you add zero point 0.5 RBC suspension to test tube number 2. Remember, the remaining fluid in the test tube number 2, before you add RBC suspension, it's zero point 0.5. So that's the sample volume. So zero point 0.5, the sample volume, plus zero point 0.5 RBC suspension. So the total volume is 1. So the dilution, current dilution is 1 is to 2. But you need to multiply this one with the previous dilution, which is 1 is to 10. So 1 is to 10 times 1 is to 2, that's 1 is to 20. Same with tube number 3. The remaining volume is zero point 0.5. So that's the sample volume. But you add 0.5 ml RBC suspension, so the total volume is 1. So 1 is to 2. 1 is to 2 times 1 is to 20, that's 1 is to 40. Okay? So the final dilution of third tube, it's 1 is to 40. Fourth tube, the remaining volume, before you add RBC suspension, it's zero point 0.5. Then you add RBC suspension, which is 0.5 ml. So the total volume is 1. So 1 is to 2. 1 is to 2 times the previous dilution, which is 1 is to 40. The dilution is 1 is to 80. Okay? And for test tube number 5, same. You have 0.5 ml remaining fluid. This is your sample volume. Over total volume, which is 1, because you have 0.5 ml remaining fluid plus RBC suspension of 0.5 ml. So the total volume is 1. So dilution is 1 is to 2. 1 is to 2 times 1 is to 80, the previous dilution. So this is 1 over 160. Okay. So for this one, same. So the dilution is 1 is to 320. For test tube number 7, no dilution or no significant dilution because this is a negative control. So the uh, content or component of your negative control, you have your NSS and your RBC suspension. No serum. Okay? So that's for the cold agglutinin test. So after this one, after the preparation, next is to centrifuge, no, incubate uh, the tubes in the refrigerator for 24 hours overnight. Okay? So 24 hours incubation, and after 24 hours, next is to spin the tubes for about 1 minute, and after 1 minute, read the agglutination. So the tube, the highest dilution with agglutination, that's the titer. So for example, agglutination, agglutination, agglutination. So the titer is 1 is to 40. If the result is agglutination, 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 then the titer is 160. Okay? So that's for your cold agglutinin test. Next, false reactions, conditions or phenomenon that can cause false reaction in your cold agglutinin test. So you have your pan-agglutination. So agglutination of RBCs due to bacterial action. And another cause, it's the pseudo-agglutination or due to rouleau formation or the piling up of RBCs like coin stocks in instances like hyperglobulinemia. So in hyperglobulinemia, you have increased possibility of rouleau formation, and that rouleau formation that can cause false reaction in your cold agglutinin test. Okay, so I think that's all regarding cold agglutinin test. Regarding cold agglutinin test, remember at warm, no reaction. This is for IgM, no, but at cold temperature you have at cold temperature you have agglutination, so you can easily reverse cold agglutinin disease. But for paroxysmal cold hemoglobinuria, you're producing IgG. And IgG, anti-P antibody is a biphasic antibody, which is capable of reacting at cold and warm temperature. So the more severe type, it's your paroxysmal cold hemoglobinuria. But regarding paroxysmal cold hemoglobinuria, it's also a transient disease. Okay, so it's not that difficult to manage, or dili siya na naka-grabe ka serious nga disease. Okay? So that's for your cold agglutinin disease or cold agglutinin test. Okay? Thank you.